Hello, everybody. My name is Franchetta Savage. I am a registered nurse and I'm the owner of Essential Health Ed. I come to you right now to talk to you about some really important topics. The main topic we'll focus on right now is diabetes. As we go into our Thanksgiving holiday, it's so important to understand that there's so many people that suffers with diabetes, maybe coming to dinner with you, that we might want to monitor and know some of these things before we go into that celebration. And then just in general, diabetes is one of those things that can be managed by so many people if you just take the steps to do it. It's not a death sentence, but it is a life sentence. It's one of those things where people have to change their lifestyle in order to live a healthy, happy life. Diabetes is a disease or a condition where your body does not make enough insulin or it makes too much insulin. When you eat food, food converts into glucose, which is sugar. That sugar is used as energy in our body. We need glucose for everything. We need it for our brain to function and have energy to work correctly, right? We need it for our heart. We need it for our kidneys, our livers, all our vital organs in our body needs them to function. So when we have insulin that's produced by our pancreas, the insulin helps that glucose that we just ate get into the cells so that it can go all over the body. That's how it works in a nutshell. Now, the problem with our diabetics is that sometimes the pancreas does not produce enough insulin to open the cells so the glucose can get into it. That's a problem. That means that they have an issue with monitoring how high or how low their blood sugars will be. If our insulin is not enough, we don't have enough insulin in our body, then that means we have a whole lot of glucose or sugar in our bloodstream. So that's our blood sugars really high. Sometimes our pancreas will produce too much insulin, way too much insulin. And then all the sugar is getting, or the glucose is entering into the cells quickly because we have a lot of insulin, and therefore we do not have enough blood sugar or glucose in our bloodstream. So it has to be a good balance in order for this to work right. It is so important that our diabetics know how to manage and monitor their own glucose level. Please talk with your healthcare providers, know your signs and your symptoms, and then if you know someone that has been diagnosed with diabetes, also be familiar with these signs and symptoms because you never know. You might be the one to help them, okay? So again, thank you for listening. If you found this information helpful or if you think that someone else could benefit from this information, please share with anyone that you know, okay? Take care, everyone. Happy Thanksgiving.